Welcome to the Fiona Stanley Hospital Fracture Clinic. At the Fiona Stanley Hospital Orthopaedic Outpatient Clinic, we care for patients with a multitude of orthopaedic conditions. Many people in our care have had a fracture. Fracture is the medical term used for broken bone. They mean the same thing, and your healthcare provider may use either of these terms. This short film is designed to give you an introduction to falls, fractures associated with osteoporosis, and what happens after a bone is fractured. People who are over the age of 50 and have had a fracture from minimal trauma, this is defined as falling from standing height or less, should be investigated for osteoporosis.
Osteoporosis means porous bones. We reach our peak bone mass at the age of 30, and after that our bone density falls as we start to lose bone mass. If we lose more bone than expected for our age, this is called osteoporosis. Bone mass is lost more rapidly after menopause, which is why it affects more older women than men. Osteoporosis leads to calcium and other minerals being lost from the bones, making them brittle and prone to fracture. If you have sustained a fracture from a standing height or less, we consider these osteoporotic fractures. This is the case even if the slip or trip that led to the fall was very serious, or if it was onto a very hard surface. Despite being more common than heart disease, breast cancer and stroke combined, 2.2 million Australians are affected by osteoporosis. That's 11% of men and 27% of women. Osteoporosis is often referred to as the silent disease because there are no symptoms, and often people are not diagnosed until they break a bone in later life. It is important to prevent these fractures from happening again to you in the future. The lifetime risk of osteoporotic fracture after the age of 50 is 42% in women and 27% in men.
Some people will be more at risk of developing osteoporosis than others. Risk factors for osteoporosis include getting older, a family history of a fractured hip, wrist, or osteoporosis, being of small or thin build, low levels of estrogen in women. This can occur rapidly after the menopause. Low levels of testosterone in men, not enough weight-bearing physical activity, or very excessive exercise. Insufficient calcium in your diet and not enough vitamin D from sunlight. Some chronic medical conditions such as diabetes and celiac disease. Smoking. Once you have a fracture, the risk of another fracture is greatest within the next year and remains higher than normal, with 1 in 3 women going on to fracture another bone within the next 5 years. This is called the fracture cascade effect. Bone density can predict your risk of a fracture. To measure your bone density, we use a DEXA scan. This measures bone density in the hip, spine and forearm and takes around 15 to 20 minutes to perform. We compare your bone density to the average density of young adults of the same gender and race. This score is called the T-score. Osteoporosis is defined as a bone density T-score of -2.5 or below. Osteopenia is the term we use for bone that is in between healthy and osteoporotic bone, with a T-score of between -1 and -2.5. Your bone density report will include these numbers. If you have sustained a minimal trauma fracture over the age of 50, a DEXA scan is recommended to help calculate your risk of further fractures and also monitor how your bones respond to osteoporosis treatment.